My name is Dr. Aisha Buckley. I am a second year maternal fetal medicine fellow here at Mount Sinai. So, Black Maternal Health Week is a campaign that's founded and led by Black Mamas Matter Alliance. And it's a week where we just promote awareness, activism, and community building that's really intended to deepen the national conversation about Black maternal health in the United States and just inspire activism and strengthen organization for Black maternal health. So, creating awareness for healthcare disparities is important because we really need to just tackle them head on as a society and as a healthcare community to try to mitigate them and improve the health of our patients and also to save lives. So, as many of us are aware, there is a significant disparity in maternal mortality in the United States for Black women compared to white women and women of other races. And this disparity appears to be worsening as time goes on. Black women are 2 to 3 times more likely to die from pregnancy related causes than white women. And this disparity is just increasing with age. And as our patient population is getting older and older, we're really just seeing this come to the forefront. And, there's many reasons why we're seeing this. There's social determinants of health. Those are social aspects that can affect a woman's health. So poverty, the environment that you live in, food insecurity, all of that can also play a role in some of the health disparities that we're seeing. Also just any environmental issues. And then there's institutional racial bias that's been implicated in the disparity gap between maternal mortality in Black and white patients. So there are many factors that contribute to health disparities. So I kind of think of it on multiple levels. So one level is the patient level. There's factors, again, like the social determinants of health that we talked about. So, education level, if there's food insecurity, if a patient is, concerned about if they're going to be able to find their next meal, it's really hard for them to focus on their health. Um, there's also clinician level factors and implicit bias. So implicit bias is actually a subconscious bias. We all have implicit bias. We don't realize it. It's the assumptions that we make about people just from our own personal experience in our lives. This can present itself at the time of the patient clinician interaction. So for instance, if a patient is Spanish only speaking and a physician doesn't take the time to get an interpreter, there may be miscommunication with the patient, or just a cultural insensitive interaction. So if a patient's wearing a hijab or, from a different culture and the patient isn't, the provider isn't sensitive to those issues, then it can also cause some factors that can lead to bias. And then also there's factors at the healthcare system level. So the experience of patients and clinicians in the United States are they live in this broader structure of the healthcare system, which in and of itself contributes to inequity. So the financing of the American health system, even despite reforms in the Affordable Care Act, it leaves some women with minimal access to health services or underinsured. And these women are more likely to be of racial and ethnic minority groups. So for instance, women who want to access assisted reproductive technology, there is a disparity, and women of racial and ethnic minorities are less likely to be able to access those capabilities due to underinsurance or no insurance. And then at the highest level, there's a sociocultural context. So the United States, we have the education system, the financial system, the criminal justice system, and all of these systems, there's a huge interplay between them. And there are structural elements like healthcare literacy, food insecurity, poverty, and those all impact a women's healthcare outcomes. So we know that 40 to 60% of maternal deaths are considered preventable, and the goal is to achieve early diagnosis and give women appropriate medical care for the pregnancy complications, and being able to closely monitor them and treat any complications that arise at the onset can greatly help influence birth outcomes. So there are a couple of different ways that healthcare providers can work to improve maternal infant health equity. One way is mitigating any implicit bias, so we all have them. So recognizing that bias and being deliberate in addressing them and removing them, so that when you see a patient that's different or you're interacting with a patient's family from a different culture, you yourself aren't contributing to any healthcare disparities by treating them different because you're not familiar with their background. Also, just encouraging diversity in medical education. We know that there's a great distrust between minorities and the healthcare system, and that's largely due to just historical factors. That patients of color haven't always been treated best by physicians, and so there is a great mistrust. And having a healthcare system that's diverse and represents our patient population will help build a trust between patients and their clinicians. For instance, right now we know that underrepresented minorities make up 30% of the population, but only 9% of doctors are people of Black background. So addressing that, promoting education and medical education and building and fostering those relationships early on is very important. And then lastly, just addressing any racial and ethnic disparities at a system level. So system-wide implicit bias training, standardizing bundles, so treating patients the same if they have a certain disease process, just to remove that human factor and any implicit bias that could be playing into a patient's healthcare.